The government is in effect telling hospitals that it is okay if we get sick, and it is okay if we die. President Trump, we have a message for you. You have failed to protect our country against the novel coronavirus. You have failed to protect the American people. You have failed to ensure that our healthcare system can meet the needs of this challenge. You have failed to protect doctors, nurses, and all other healthcare workers. In doing so, you force us to risk our lives in order to save our patients. Across the country, nurses are caring for patients without the personal protective equipment that we need. We should be wearing highly protective gear, such as N95 respirators, face shields, coveralls, and gloves. Instead, many of us are wearing bandanas, scarves, or cloth masks, and we're forced to reuse our masks, coveralls, and gowns for days on end, which is unsafe. What does this mean? It means that many of us are getting sick, and many of us are dying. It means that many of us are bringing COVID-19 back to our children and families. It means that we're infecting our coworkers and too many of our non-COVID patients. In fact, 20% of all confirmed cases of COVID-19 in this country are nurses, doctors, and other healthcare workers. We are contracting this deadly virus in large numbers because our government and our hospital employers have failed to provide us with the optimal personal protective equipment that we need. When we get sick, who will take care of our patients? Weeks ago, our nurse colleagues in Italy and Spain, where the pandemic had spread out of control, warned us that hospitals in their countries had become disease vectors. And now, that is what is happening in America. Instead of being places of healing, hospitals have also become places of infection. And the United States government has let this happen. The CDC has consistently weakened its recommendations on the protection that nurses need against COVID-19. Right now, the CDC is telling hospitals that it is recommended that they only provide us with bandanas, scarves, or surgical masks. And because of this, and because OSHA has refused to do its job to protect the occupational health and safety of nurses and other frontline healthcare workers, the government is in effect telling hospitals that it is okay if we get sick, and it is okay if we die. Nurses across the country have also been demanding that President Trump and Congress scale up production of personal protective equipment and to get us the PPE that we need. Yet Congress has now passed 3 coronavirus bills, and none of them have anything to protect us. In the richest nation on the face of the earth, the White House, Congress, the CDC, OSHA, and the hospital industry have condemned nurses to death and illness.